Hello everyone, this is your Dr. K. Samyukta, consultant urologist and urogynecologist. Today we will talk about what is the ideal diet to prevent kidney stone formations. Kidney stones are one of the most common urological conditions with which patients come to us regularly. And the most common question they ask is, how do we prevent these stones from formation? The first and foremost thing that we would like to tell patients or any of our viewers is adequate drinking of water. It is very important to hydrate yourself with water. The more you hydrate yourself, the lesser will be the chances of stone formation. So what is the ideal amount of water you need to drink every day? Ideally, you are supposed to drink anywhere between 2.5 to 3 liters of water. It is not like you drink 1 liter in the morning and another liter in the evening and then you've completed. You have to hydrate yourself all throughout the day, about 24 hours, with about 2.5 to 3 liters of water. Apart from water, you can also hydrate yourself with coconut water or fruit juices, but it is very important to hydrate yourself. The next most common thing that we want to tell is, apart from this, a lot of patients also ask us that, is having calcium an increased risk for stone formation? No. If you completely stop calcium from your diet, you will definitely increase the risk of stone formation. But if you have calcium in moderation, that is about less than 1500 milliequivalents per day, that is good for your body and it also prevents stone formation. So calcium in moderation is actually good and also prevents stone formation. So for patients who are recurrent stone formers, we would suggest them to avoid oxalate rich food, because one of the most common stones that form in the kidney are calcium oxalate stones. So what are these oxalate rich food? So generally these oxalate rich food are nuts, then you have rhubarb, you have spinach, then you have tomato. These are relatively high oxalate containing foods, and these oxalate containing foods can result in stone formations. We generally ask our patients to include a lot of vitamin C in their diet, because vitamin C prevents stone formation. So vitamin C taken naturally is very good through increased amount of fruit intake, especially citrus fruits or lemon, or which are very high in vitamin C. Or we also ask them to have regulated dosages of vitamin C as tablets every day, which prevents stone formation. We generally don't say our patients to completely avoid junk food like processed food or junk food or deep fried items, but we would suggest that if you can have once a week like a social gathering, or normally, that would be okay. But if you are going to have these highly processed foods, carbonated beverages, deep fried items almost 3 or 4 times a week, then there are increased chances of stone formation. So the ideal things that we would want the patients to do to prevent stone formation is, please try to include every day at least one fruit in your diet. It can be any fruit. Fruits do have antioxidants and they do prevent stone formation. Apart from that, including a lot of green leafy vegetables or vegetables per se also decreases the chances of stone formation. Thank you.